We still have quite a fair bit of time, so we should be okay. Next up, finally, we have Masaaki Suzuki. Professor Suzuki is attending us for the first time. Welcome. And that's following an invitation from Dr. Teikyo. He's the Professor of Otolaryngology affiliated with Teikyo University in Chiba in Japan. And he's currently the editor of the Journal of Japanese Society for Pediatric ORL. He has a specialty sub-interest in otologic surgery, and today he's going to be discussing the etiology of tympanic membrane perforations in children, and he will also be discussing his newer treatment using beta-FGF.
Hello everyone. The topic I was given is etiology of tympanic perforation in children. However, I'd like to talk about a new treatment using basic fibroblast growth factor as well. I have no conflict of interest to declare. Chronic perforation of the tympanic membrane in children is common, usually resulting from trauma, otitis media, or tympanostomy tube insertion. Etiology of tympanic perforation could be first, the proliferation of fibrotic and scarred epithelium as the perforation margin is considered a major pathogenic failure of tympanic membrane perforation closure. The remaining TM becomes thickened by fibrous proliferation that can extend to the margin of the perforation and even to the tympanic cavity. Second, fundamental fibrous middle layer deficiency. Third, lack of regulatory factors such as growth factors, and so on. Clinical and experimental studies have shown the healing potential of various growth factors on tissue repair. FGF2, that is, basic fibroblast growth factor, might have properties associated with augmenting granulation tissue formation and promoting organ and connective tissue repair during proliferative stage. FGF2 stimulates proliferation and differentiation of endothelial cells and fibroblasts at the perforation margin in TM perforation. These healing processes of the epithelium layer facilitate TM regeneration at the perforation margin, bridging the tympanum. An early study showed that after basic FGF application, an epithelial hyperplasia is found with several epithelial layers. Blood cells are present beneath the basal membrane. However, no structural modification is observed after placebo application. Based on these experimental data, Dr. Kanemura of Kyoto University in Japan developed a promising, less invasive treatment using basic FGF, gelatin sponge, and fibrin glue. After a mechanical disruption of the TM perforation edge was made under the microscope, a gelatin sponge immersed in basic FGF was placed over the perforation in contact with the tympanic membrane. Gelatin sponge have a much looser structure than collagen, enabling proliferation of cells. Proliferation of a new layer of epithelium along with blood vessels on the TM surface occurs. The key point of this method is to proliferate not only the epithelial outer layer, but also the fibrous middle layer. These healing processes facilitate TM and fibrous layer regeneration at the perforation margin, bridging the tympanum. Surgery was performed under local anesthesia. Several pieces of cotton immersed in 4% lidocaine were applied to the TM. After removal of the cotton, the periphery of the TM perforation was cut with a microneedle. The old tissue around the entire circumference of the perforation was removed with a forceps. In this procedure, all three layers of the tympanic membrane were exposed as new wound. A gelatin sponge was soaked in recombinant basic FGF, positioned to cover the entire tympanic membrane perforation. Then fixed to the tissue using a few drops of fibrinogen and thrombin glue. Surgery was performed under local anesthesia on a 13-year-old girl with chronic otitis media. Slide shows tympanic membrane status of pre-operation at 16 days, 1 month, and 2 months after the treatment. The tympanic membrane was completely regenerated at 2 months after the treatment. The air condition in the right ear improved. Surgery was performed on a 13-year-old girl. A gelatin sponge remained 3 weeks post-operation, then was removed. The tympanic membrane was completely regenerated at 1 month after the treatment. The air condition in the right ear improved. Surgery was performed on a 13-year-old girl. The tympanic membrane was completely regenerated at 1 month after the treatment. The air condition on the left ear has been completely recovered. In this case, the tympanic membrane was moist before surgery, but surgery was performed. Otorhinolaryngology occurred 1 month after surgery, but cleared up 2 months after surgery. The tympanic membrane was regenerated 4 months after the treatment. The air condition in the left ear has been completely recovered. In this case, inflammation occurred 9 days post-operation, but it cleared up within a month. The tympanic membrane was completely regenerated 2 months after the treatment. The air condition in the left ear has improved. We performed this procedure on 21 years who never underwent surgery, and 20 of them have successfully closed the tympanic membrane perforation using this method. The one unsuccessful patient had immunodeficiency and had an F-cell-deficient eardrum. In conclusion, basic fibroblast growth factors might have properties associated with augmenting granulation tissue formation and promoting organ and connective tissue repair, stimulating proliferation and differentiation of endothelial cells and fibroblasts at the perforation margin in tympanic membrane perforation. 2. Promising, less invasive treatment have been developed in Japan. Treatment kits of the basic FGF and gelatin sponges are currently for sale in Japan. Thank you very much for your kind attention.